there was something that made you start taking the drug?
No, just friends told me that I will have a lot of fun and happy life.
All right, okay. And what do you feel about it?
I feel that I'm very guilty and I'm totally sick with it.
I understand, it's all right. So can you tell me a little bit more about how you take the drugs?
So you see, I took them almost every second day. The last time I took yesterday.
All right. Have you tried stopping cutting down on taking?
No.
All right, that's okay. So can you tell me if you've ever had any, if people around you were ever annoyed that you took these drugs?
Yes.
All right. And you said that you felt really guilty about it, right?
Yeah.
Okay. And how about if you felt like it's the first thing you want to do every morning when you wake up?
Yes, I think so, yeah.
Okay. And do you think that you need more of it every day to
Yeah.
reach the same level?
And I've noticed I'm shaking.
Oh, all right. Okay.
Yeah, you see this.
Since when have you had that problem?
A couple of months.
Couple
by
of
now.
months. Okay. All right. And do you have any other features like this?
I am upset. I am simply not interested in my life.
Oh, okay. So when you take these drugs, do you take by yourself or do you do it with other people?
With my husband.
Okay. And do you have any children at home?
Yeah, 2 children.
Are they present when you're doing this?
No.
Okay. All right. So if I'm going to ask a few questions that may be a little bit uncomfortable. So can you please tell me how your mood has been recently?
I was fine, absolutely fine. But this a couple of days, it's low, maybe it's low.
All right. Okay. So don't be alarmed by the next question. But have you ever felt like you need to harm yourself or something like that?
No.
Okay, that's very nice. Okay. Do you have a good supportive friend and family group?
Not much.
All right. Okay. And okay, so sometimes people may feel like there are things that they're hearing or seeing that don't actually exist. Has it ever happened to you?
No.
Okay, that's very nice. Okay. So just asking some questions about your general lifestyle. What's your diet like?
Yeah, I feel, yes, I eat, I cook sometimes and
Oh, that's
I
very
eat
nice.
okay.
Okay. And how about exercise? Do you do that regularly?
No.
Okay. And do you smoke anything?
No.
Okay.
Yes, sometimes some weed. Yes.
Oh, so okay.
Occasionally.
All right. And can you tell me how much you smoke?
Once a week, probably.
All right. And is it with other people or is it by yourself?
As well with my husband.
Okay. And are kids present at that time?
We try to avoid,
All right. Very good. Do you ever drink alcohol?
Yes.
Okay. And how much? Could you tell me?
Beer sometimes, after smoking.
Oh, okay. All right. Just asking a few questions about your general medical health, all right? Do you have any medical conditions that you know of?
No.
All right. Are you taking any regular medications for anything?
No.
Okay. And how about any allergies? Do you have any?
No.
Okay. Okay, so this may be a little bit of an odd question, but have you ever had any mental illnesses in your family?
No.
Okay. All right. And what do you do for a living?
I'm cashier.
Okay. So can you tell me if all your habits have ever affected your life in any way?
Yes, sometimes I was like thinking about quitting my job because it's so boring.
All right. So do you ever feel like you need medical help to stop taking it?
Recently, I have started to just in this way.
All right. I'm so glad that you're here for that. Okay. So okay. So what we're going to do for you is we're going to start I'm going to refer you to a few different places. Like we're going to start on some psychiatric help, and that would be referring you to cognitive behavioral therapy, which will help you get used to stopping the drugs. And we're going to, can I examine you for a little bit?
Yes, please.
All right, so I'm just going to check your vitals. I'm going to check your vitals and I'm going to do a head-to-toe examination and I'm going to see for needle marks, all right? Okay, so what we're going to do is we're going to start you on cognitive behavioral therapy. And there is a medication that I'm going to prescribe for you, which is called methadone. Now, this is going to be a very long-term medication. It takes sometimes about 9 months to a few years as well. And you're going to have to take that medication regularly so that you can really stop this. All right. And what we're going to do is we're going to offer there are some support groups called Narcotics Anonymous groups. Okay, which would be very beneficial for you because there are other people like you who are suffering through the same things and they're doing the same things as you. And it will be very helpful to you so that you can see the same things and you can apply the same procedures that they have done so that you can quit as well. All right. How do you feel about that?
Yeah, that's appropriate for me. Yes, I would like to try. Yes.
All right. And do you have any concerns that you want me to address?
How to help my husband, because he doesn't want to come at the moment, and I feel that he can involve me again and again.
That is a very good question, and the best thing that you can do right now.
Next session.
Good. Next time.
Good. Next time. Well, good. So have a seat. Keep sitting here. So we circulating anyway. So Ramesh, you give feedback first, and let's talk about first. Let's talk about from there. So Imran, you tell first. What do you believe the thing she had missed and what she had done wrong?
Yeah, so it was good. First station was video that you did not do, so leave that. So we did not want to discuss about that. We did it here. So you spend too much time on history taking. That's why you don't have time for examination, I would say. Yeah. Yeah.
Okay, no problem. Allah, what do you think you want to add on anything if you have done this station before?
No.
No, it's not. It's important anyway. You will do some point. So let's come to Ramesh. Then I will give feedback as well. Ramesh, you have Alina in front of you. You can speak to her.
Oh, yeah. So, she started off well. Her IPS was good when she started with it, but in the history part, I felt that some of the questions they were not structured well. For example, you said that when you were talking about tolerance, so you said that do you need the same amount or the increased amount to get this to reach the same level? So instead of saying this, what you can say is that do you think that you feel the need to increase the amount to get the same feel, because you don't know the amount and the other person also don't know about the amount? So you can ask about the same way, or can they feel the same way? Do they need a more increased dose to feel the same? Other than that, you have to ask about, like, are you able to perform your daily activities, this question. And regarding the needle sharing and the needle exchange program, and you didn't talk about that, I guess. So you said that on the suicide question, that don't be alarmed when you were asking about the suicide. So I would suggest you to ask that when sometimes people go through difficult times in their life, and they would like to hurt themselves or hurt others. So have you experienced such kind of thoughts? So you can ask this instead of saying that don't be alarmed by my question. Other than that, I also wrote that you asked about allergies. Allergies isn't needed here. So because the history itself in this station is a lot, like you have to ask about the itself history, you have to ask about the like famish history, TWD history, and the cage history as well. So let's not talk about irrelevant things. And when you were doing the examination, you like included the examination later on. But obviously, if it's a video consultation, then you are going to say, if you would have been here, I would have personally taken your vitals, and I would have had taken a general physical examination from head to toe. You don't need to say that I would be looking for some needle marks, because obviously, you know, the patient has come in itself and the patient is saying that I'm taking heroin and I want to like leave it. So also you can talk about some support from the parents, or by any chance the patient is involved with police anytime, because in the calibration it's written that the patient would be involved in stealing as well. It's written in the calibration of the scenario, so obviously they are going to ask something like this, or they expect you to say this. Other than that, yes, you didn't have time for management. For what I would suggest, that you really have to talk about rehabilitation, that we have to send you for rehabilitation, and like you have to talk about other NHS sources, that NHS has a lot of social groups, and NHS is working a lot for detoxification programs, and regarding the methadone you already mentioned. So yes.
Okay, good. So yes, I would add few of the things for myself as well, Alina. So basically, you actually done well, but a few things which I would like to add on is, so let's go one by step by. Before I give you feedback, let's talk about who will do the next one. It is cocaine, alcoholic, fifth year medical student. So anyone from online or Allah who want to do? So anyone from online, doctors whose exam is in August or September, they can do. If not, then we have Allah, we have who want to do registrator. So we have Imran who want to do that one as well. And if anyone want to do from the colleague, that's fine. So there are two stations in the colleague. One you can do, one out of you about the social media. Have you done it? Okay, you haven't done. No, that's fine. So we'll talk about that anyway. So let's quickly talk about the things in this particular scenario, what you've done actually. So you done, if I say overall IPS was amazing. IPS, the way she opened the first minute and everything, telling that you're gonna get help. So overall consultation, I would say, if I am an examiner, I will get that vibe, catching vibe that she has something to help with, and where it was. So I believe, so there is a one, someone have raised their hand. You can write in the chat box as well, and you can turn on your camera if you want to do it. We'll get you involved in somewhere. So overall vibe, the vibe of the scenario was good, because she in the first 1 minute was good. Last 2 minutes, again, I'm not happy with the last 2 minutes. So the first 1 minute was well done, but last 2 minutes, if I say, if you have done the last 2 minutes well, I would say, no, we have to work.
I haven't finished
We
yet.
have to work, okay? So we have to, but I'm happy your opening, your history taking skills, bit of, and let's talk about the how we divide our consultation. You entered into the room, you're reassured, you know the issue, you talked about few question about that. Present day, how she feeling, withdrawal symptom, did you ask about that? Anything?
She mentioned something and then I asked any more symptoms or not.
Okay, that's fine. Then that's fine. You ruled out that. Did you ask about the children?
Yes.
Good. So Meftosa famish finances. Did you ask?
No,
about, you didn't ask about finances at all. That was a thing where Ramesh pointed out that as well. Insight, that is already done. ID, expectation, and concern. Effects on the life.
Yeah.
Good. So you did on examination. When you will come over, we'll do that anyway. That's a good history taking skills. When I come to the management, is that stay connected. The first of all, again, I would like to thank you, and I would like to appreciate you that you seeking help, and you will get everything what you need. For that, I'm going to provide you. Think about 4 points here. So you will be coming to the hospital. You happy to come? Appreciate. So more of interaction was required there. Thank you. You come. What we will do, we'll examine, we'll see, we'll do some bloods to see the level of toxicity, or some bloods to see what's going on, infection or whatever. And on top of that, when you come here, we'll give you medication to clean your blood, to get the things or make you clean on that. So you will tell them that what you will do, and the medication you can top up, you discuss about methadone, well done. Narcotic Anonymous is a sport group. You could have mentioned that. That would, yes, good, brilliant. Reading material, journey, you discussed about the journey, safety netting, brilliant. But again, safeguarding issues for the child, you could talk about that, partner thing and all that. Anyway, that was a good consultation. things can be improved a bit more, but up till now, I'm happy what you are doing because you just came 2 days ago here and you're participating and you're good learner. Again, Alan. Good. So well done. So we have another colleague. So who want to be, Ala, you sitting here, you like to be the colleague?
Imran.
No, colleague, mean the student.
Yes, I will.
So you would be fifth year medical student.
Mhm.
Okay, Imran is the doctor again, and we have someone raise the hand. Just write your name down so that I note it down and give you the next scenario. So we
It's Dr.
have
So he is also interested in doing a scenario, so he can do the
Dr.
next one. Maybe.
Dr. Justin is so Imran,
Yeah,
can you give just we'll see another one, Justin from another nationality, so that let's see how Justin. So the student is Ala. Okay,
Mhm.
and Justin will do that. Imran, you become examiner in that. Okay, and Ramesh is the examiner. So Justin, I'm gonna put you on the. Just give me 1 second. Let me pin you. Thank you very much, Justin.
thank you very much,
for-
Dr. Khan.
Thank you. Well done. Good. So it's a colleague. So calibration will be done by Ramesh, and the student is Allah. She is fifth year of medical student.
Mhm.
So let me tell you. So the only thing which I will tell you now. So you saw her in the party. You suspect she was sniffing cocaine and drinking alcohol, and you feel she's a bit hyperactive, and the other staff member think that the same thing. That's the only thing you will find outside. Do it. I'm not going to give further calibration, but you know that you will not agree
Yes.
until you feel the doctor is telling you
Yeah.
help or confidentiality,
Mhm.
but you will agree at some point
Mhm.
and you'll seek for help, but doctor would be doing everything here.
Yeah.
Okay, so let's start doing it. Okay, so timer, Ramesh can put on timer. I can put.
Again. Enter the
Hello,
room.
James number 793.1. Hello,
Hi.
yeah, I'm Dr. Justin, one of the FY2s in the department. Could you please confirm your name?
I'm John.
All right, John. It's nice to meet you. I'm Dr. Justin.
Nice to meet you too.
All right, so you can call me Justin while we discuss. Is that okay?
Yes. Yeah.
All right. So, John, how's your day going?
Quite good. So I'm busy. Yeah. And perform my job.
All right, that's great. So, how's the posting going currently for you?
It's okay. Sometimes I ask my colleagues like what to do if I don't know. But anyway, I try to manage everything.
All right, I'm so glad to hear that. Are you facing any challenges so far in the posting that you need help with?
No, I didn't understand
Oh,
the question.
okay, all right. So I'm glad to hear that, John. All right, so John, I want to really thank you for honoring my invitation. Happy to see me despite the short notice. But by any chance, do you have any idea why I called for this meeting?
No, to be honest, I'm surprised. I need to go to my patient.
Oh, yeah, John, I understand that you have the responsibility of looking out for some patients, but don't worry, I won't take much of your time. I just need a little chat. Is that okay?
Yeah, okay.
All right, John. So I actually saw you at the birthday party last night. How was the party?
Oh, great, super.
All right. So I was actually happy I saw you there, as medical practitioners, it's important that we unwind sometimes, do something out of work and academics. So I was so happy to see you there. So keep that up.
So, doctor, what do you mean by all this?
All right. So just that the main reason I actually called for this meeting is that during the party last night, John, I actually saw you sniffing something that looked like cocaine. John, I understand how this could be embarrassing, but I mean no harm. I'm actually here to help you.
No, it's not about me. I was not sniffing anything. I just had rest and, chat with my friends.
Yeah, John. So I understand that bringing up an issue like this could actually be embarrassing. It's not be easy for you to open up. But be rest assured that whatever you tell me here remains confidential between me and the team or whoever that can help you. I'm not here to judge you. I'm just here to see how best to help you.
I'm happy with my life and I don't need any support, I just need to go to the patient.
All right, John, don't worry. I'll be leaving very soon so I can go see your patient. But John, very soon the nurses will start talking about it. And because I noticed that you seem a little bit hyperactive today, you seem a little bit overexcited. So I'm quite concerned. And as medical practitioners, it's not good for us to work under the influence of some certain substances. But John, be rest assured,
Right.
I'm not here to judge you. I mean no harm. I'm not here to criticize you. I just want to see how best we can help you.
Is it very visible that I am a bit, excited? I thought that I look fine for others people.
But I didn't get
mean-
that.
I mean, is it very visible that I'm behaving a bit different?
Oh, John, yeah, it's a little bit obvious, and the nurses have started talking about it. So that is the reason why I actually called you out to speak with you privately. So you don't get into trouble, because it's important to look after each other as colleagues, because that is what we have to do as brothers and sisters in this profession.
So what could you suggest to me? Okay, if I have some trouble with cocaine, do you know what to do in this case? But you mean, I don't want to involve anyone.
Right, John. So I understand that you don't want to involve most people in this, but how about to involve only those people that we be involving directly helping you so that you can get to quit? How does that sound?
Yeah, maybe I need to think about this. But again, I need to complete my job because I will get in trouble.
Don't worry. I can only speak with your seniors to let them know that you're with me. But John, how about if I ask you a few questions regarding your life? Is that okay?
Yes. Yeah.
All right. So are you going through any stress currently? That stress at home or at school? Are you?
No, apart from everyday stress at my job, no, nothing specific.
All right. So for how long have you been taking heroin? Have you been taking cocaine?
Yes, it's cocaine.
For how long? How long have you been taking?
For how long? For 6 months.
Okay. So is there any specific reason why you're taking cocaine?
No, no reason specific.
All right, John. Apart from cocaine, do you take any other substance?
No.
By any chance, do you smoke?
Yes. No.
Okay. So
2
for,
minutes
for,
from
so for how long have you been smoking, John?
For 5 years by now.
Okay. By any chance, do you take alcohol?
No.
Okay. How's your relationship with people? Do you consider it to be good?
Relationship.
Yeah, with people. Do you consider it to be good?
You mean relationship with my partner?
Yeah.
Sometimes fine, sometimes not.
All right, John. Okay, so John, thank you very much for opening up to me. I really commend your bravery and your courage. I understand this is a very difficult thing for you, but like I showed you earlier on, I'm only here to see how best we can help you. So John, how about if we speak with the unit consultant, tell him what you're going through, and see how best he can help you. How does that sound, John?
Yeah, sounds great.
All right, so that's good, John. Then I also want to advise you to make an appointment with your GP, because in the NHS they actually have services that are available to help people that want to quit substances, also to quit smoking, because it will not be good as a doctor. You're working under the influence of these substances. It could actually cloud your judgment and put people at risk, John. So would you mind making this appointment with your GP?
Yes, but I am every day need to go to my patients. I mean, everyday's job. When to do this, I don't know.
All right, John. I'm sure by the time you speak with the consultant, they can give you time to go out to go for this appointment. They will.
Mhm.
All right, so John, I'll need a list of the patients you have seen today, just to double check everything you have done. You know, I don't doubt your mental capacity. I don't doubt your experience and your knowledge. But I just want to be sure that you've not made any an error that will land you in trouble. Is it okay? We'll just review your patients together.
Time.
All right. Thank you very much, John.
Yeah.
Yes, good. So let's hear from Allah. You know the approaches, isn't it?
Yes, twice.
Would you like to
Yep.
tell anything which he missed? But I believe before anyone speak, well done, man. So you speak now, Allah. What do you think?
I think I was quite tough. I'm
Yeah.
too much. I'm sorry. I not always understood your speech. You have a bit different accent. So
Yeah.
it's not your fault and not mine, just simply
But don't worry,
communication.
I was telling her from behind because I was understanding. I have a lot of Nigerian friends, so I would say yes, no.
Dr.
All
Zisha,
right.
how do you know Nigerian?
Yeah, you were very powerful, very good.
Yeah, good. So the thing is, I believe you finished all of the spice approach for the colleague, but few of the things which I will definitely comment on. But before that, let's listen from the lady Ramesh. She's very always critical and helping. So listen to her first. Okay, Ramesh.
Well,
All
no, it was a good consultation, but I would like to ask Dr. Kazmi. He's here, so maybe he can tell.
Kazmi,
Yes.
how are you? So let's hear from Kazmi first. Kazmi, you should tell all the time when you are here. So you need to mention that. You don't because you just like we can't see you some. Yes, Kazmi, yes.
Hello, hi, Zishan, you okay? It's
I'm
good
good,
to
I'm
see
good.
you doing in the room. That's a different setup
Yes,
today.
so I have decided to be in a circular table so that I can rotate. Here. So I'm
Okay.
putting more pod camera pod sets. So I spend a bit more money because I'm getting more people now. So,
That's
so what?
that's a free
Yeah,
mock, isn't it? Like, for everyone.
yeah,
Yeah.
Mox is getting people coming, mocks, hands-on, and everything. So yeah, I'll just go. I will definitely make it a much better experience. So yes, Kazmi, what comment you will
Hmm.
say about just
Yeah, it was a good attempt. He was not, she was a bit tough, and in other sense, I would say it might be a maybe true patient, because if he's having symptoms at the moment, then she was not she was a good actor in that sense, because she was having symptoms. So if somebody is excited, so he will not behave like normally. So I think it was okay. Uh, Otherwise, he was very good. What I like about him is he was not leaving her. He wanted to complete his, what he wants to say, and it was a really good approach. However, um, I would say, don't approach this types of station as a patient. When you started, I was feeling like, in NHS, when two colleagues talk with each other, it's very friendly, very, very, even with patients, but especially when you talk with your colleague, it's like, you're talking with a friend, and your tone, your body language, your words should be very, very, friendly, and making a very good rapport very quickly. Okay, so when you started, it was a bit of like you are talking with the patient. Okay, so other than that, when you moved on, a couple of things like, can you book, some phrases would be very helpful, like you are doing right job, but a couple of phrases if you add would be very helpful. For example, when you said, are you going through something in your life, for example, you can say, sometimes people do have, do this for, just for having excitement. Sometimes people have, do this because they are undergoing some stress and they need some help. So, is there anything going on in your life would you like to share? So some like same thing, but in a very good phrases. and other person would like if you use these type of phrases, the other person would love to share things with you. And when you say like you see a GP, and again you can say indirectly rather than you say, can you please book a GP appointment? It's like you are not giving an offer, you are just saying to do it. So you cannot say even to the patient. So your colleague, you say, I feel like you should see a GP as well. What do you think? You know, something like that. So you giving an option. I think it would be very helpful to see a medical if you need it, for example. So also I would like if you ask. If he gets some symptoms, if not, he doesn't, do it some withdrawals. You know what I mean? So that would be question I would like to ask. And the other thing was, um, just a second. So the other thing was when she is saying like 2 3 times, I would like to go to I need to see the patients. She said 3 times. So I would say it's very important to say if anything like urgent and any emergency, something like that. I would always say, because even this meeting can be cancelled if patient is in at risk. Yes. So I would say you always ask, is there something emergency going on? We can, hand over, we can call somebody, or we can go together. Just give option. In exam, they will not say, let's go, isn't it? So it's very important to put the patient safety here whenever she mentions, okay? And you when she's saying I wouldn't you said I would double check the patient you've seen today, that was right thing to do. But how about she should not continue today because she's having symptoms? Yeah. So would you let him continue today? So obviously you will ask her to go home. How about taking home, so things like a practically. And if somebody when you're saying you should say very nicely, as a colleague, if I put myself in your shoes, I obviously as a doctor I would be worried about patient safety as well. Obviously you are a great doctor, you are competent, there is no doubt about that. But patient safety can be sometimes compromised, you know what I mean? But how about, sometimes we end up with problems like with GMC. So I'm concerned about you. I really want, you to think about this. How you think about that? Have you given any thoughts about that? So something like that. But obviously your approach is okay. You know what you're doing. But a couple of things like phrases and stuff, if you add, it will be great consultation. Thank you.
Thank you, Dr.
Brilliant.
Kazi.
Thank you very much, Kazmi. So excellent. Again, I want to talk about the same SPIES approach, SPIES. So I will mark you on that. Everyone listens, especially Alina, because this is for you, and Allah, you've gone through the crash class, you know that.
Yeah.
So I start with the setting. I give a mnemonic with S. Remember S. S for signpost. As for setting, for the setting would include as for setting and seeking. So you know the setting that thank you very much for meeting me on such a short notice, and signpost that I want to discuss something very important. That is signposting. Thank you for meeting me on such a short notice, and thank you because I want to discuss something very important related to helping you. But before that, another S. Would you like to share anything you're going through, like any challenges? Okay, any challenges you would like to share? Any problem while seeing another S? While seeing a patient, I mean, I brought patient safety in the start. That is P for patient safety. Would you like to share anything with me? Ask in the start. Ask that he himself would like to share. Do you have just signposted? No, doctor? Then he would say anyway, I want to know why you have done. I will definitely will be discussing, but signpost. As share, would you like to share? Signpost it. Then the next thing is patient safety. And when you talk about the patient safety, another S you want to write down. Any stress going on in the department, you feel any stressful environment or any burnout going in your work. These are the causes. Any burnout going in the work or in your personal life. He will say, why you are asking? I'm sorry, I'm just trying to help you if you are struggling anywhere. Because sometimes work is connected with the personal life. This is how you will answer. Again, S, remember signpost, share. Would you like to share anything? This is approach. If you remember, you can get 12 out of 12. I'm telling you. Would you like to share anything? First of all, signpost, share anything, stress, any problem while seeing patient, any challenges. That is 2 part. S and P is done. Then I for. So he done well. He actually signposted thing. He asked about, would you like to share any challenges? And that was perfect from my side. What is I? I for initiative. In I, what you was expecting to do, bring in the issue. What issue? Michael, I can see that you're looking bit off or looking bit hyperactive. You're not doing any eye contact. You can acknowledge that. Would you like, are you going through any problem? Basically, what I have overheard, I have noticed that you're looking not yourself. Would you like to share anything? No, I'm okay, I'm all right, I'm totally fine. That thing. Then again, actually, Mike, basically, the reason I wanted to speak to you, I saw you on the party. How was the party actually, by the way? Yes, he did the same way. Would you like to share anything about the party? Ask open question, no? You was there. Yes. So basically, I have seen you there. And I suspect, I'm not saying I'm suspect you were sniffing something. Would you like to share anything about that? No, I was not. Then offer confidentiality and remind, I'm not judging you the same way Justin done. Brilliant. I'm not judging you. I'm here to help you. No, doctor. Then you ask another question like Justin asked. Do you know the guidelines about drugs and alcohol for the doctors or medical students? But he was a medical student, might not be seeing any patient as at that point. Okay, you can ask about studies over there. Okay, no, doctor. Then again, you explain him that you are here to help and these things can happen. So at that point, he would open up. When he open up, thank you for sharing with me. Thank you. Now we need to sort out. What I believe you done well, but the only thing which Kazmi mentioned is that you don't need to go in detail apart from few questions because you're not his doctor. Just need to ask how long you're doing it with whom, other doctors. Okay. Then again, stress already ruled out. What was the reason? And how long? That's important. And by any chance, when you come to work, do you take those? That's it. You don't need to take a detailed history, KHTW home. You are not his doctor. Now, the most important part here is, guys, which you need to focus on, what it is. Escalation. You have to put more time on that. Patient safety. Then you will say, as a senior, Michael, I understand that has happened, but I would like to tell you GMC is a bit strict, good medical about the patient safety. So I will be sending you the the GMC guidelines, but at this moment, I'm concerned about the patient safety and your safety as well. Is that possible? You go to the consultant and now speak to him and tell him before anyone else tells. How does that sound to you? No, doctor, I can't. I can help go with that, but at this point, I want to help you sport. What sport you're offering as per sport? I want that you go home today. You're not well. By any chance you're driving? No, I'm not driving. I still remember once I was working like on a long shift, and one of my consultant came. I just felt I'm not feeling a bit well because I haven't eaten. So what first question is asking me, consultant asking me, you're driving today, shall I drop you? So this is the way, patient safety, your safety and public safety. Okay, so sometime you ask about that, you are right. Will I order a cab for you? Is it okay? That was the important safety question. One of my students who got 12, in one station who got 2 in one station because he missed 1 point of driving. So that's the main thing you need to understand in public, in the Plab 2, which is most important thing you need to speak, not everything, just 3-4 points are important. So that's a good point. Speaking to the consultant, driving home and seeing the patient, reviewing the patient. If you miss those 3 points, might be the scoring criteria is those 3 points. If you say those three points and you don't talk about anything else, you might not be score negative. They might get 12 out of 12. The patient safety, speaking to the consultant, telling GMC guidelines that you will be scored on tick, tick, tick. If you don't say that, maybe that is a major and you will 2 in management, 0 in management. Need to understand design. When they score, it's a big, good medical practice. GMC is your accountability partner, basically. They want to see when you pass, are you fit to the medical practice? When they make a criteria like a driving test, major mistakes, they don't want to fail you. If you are a safe doctor, they don't want to fail you. Okay, they want to see. That's why they put every type of scenario in your. So I hope you understand this what I told, and you think about summary, quick summary. As for signposting, sharing things, then checking that patient have seen or not, then signposting what you want to talk about, and bring that issue. But he's a medical student, he might not have seen patient, but you will tell that in future. Okay, but if of F1, you will talk about that anyway. Well done, guys. This is how we do it. So the next one, who want to do from the online or from on-site? So let's talk about the next one, which out of the cases.
Thank you, Dr. Thank you, Dr. Zishan. I appreciate the feedback.
Your exam, Justin.
It's in September 3rd.
Okay, do meet me. At least if you already took any course, take mock at least. You just need a drill, you'll be all right, okay?
Okay, maybe when I'm coming to the UK, I'll message you.
Yeah, just do come because you are well prepared. So let's talk about the next case. Let's see who want to do. So we have the case and let's see who want to get assessed. They are good at it, or if they are good at two type of people should do these scenarios. Who they are not good at it or they are very good at it. If they are very good at it, they will get the confidence when they get appreciated. If they are not good at it, they know what to do. Okay. So, and if you're very good at it, you are helping people. Okay. And if you help people, ultimately, the nature code is that God will help you. Okay. So think about that thing. So let's talk about chickenpox fit note. The mother would be Ramesh anyway. So tough mother. Okay. So Ramesh, you will do the fit note. I mean, you will be demanding patient, isn't it? Okay. You know the calibration, Ramesh? You are muted.
Yes, my son, he would be having chickenpox and I would need a fit note.
Good. So who want to do it from any of the online registered doctors or non-registered, doesn't matter, who want to do it, who has exam nearby? Let's say in the first week of August, if they want to do it, or second week of August. If they want to do it, go for it. And our next mock is coming on site on Wednesday, 14th of August. And our next course is starting on the 12th of August, full course. Discounts are there if you want to ask. So no one want to do that from the online, guys. It should be. So who want to do? Imran, Allah, you?
Nasir
no,
wants, he has raised his hand.
Nasir, first, because Imran already told before. So
Okay.
Nasir, can you turn on your camera first? Let's say hi to Nasir first. Nasir, have you turned on your camera to say hi to everyone? No. Okay, no problem. So we have now, who is with us? Imran. And Allah, you become the examiner, and Ramesh will be the mother. And so you will see then the approach this station will cover all the station of unreasonable request. So let's see. You want me to tell you a bit of things what I'm expecting so that you perform well.
Yep.
Right. So if I miss anything, Allah, you can add on as well. So you will be the app two. So she will do the calibration. Let her do the calibrations and what
Okay.
I will be expecting.
Yeah.
So Ramesh, do the calibration with it.
I don't really know about the detailed calibration. I just know that the patient comes in and the mother comes in and she says that I need a sick note. My child is having chicken pox. So basically, you have to ask about how long does the child has chicken pox. Then you can ask about the symptoms if the mother has any kind of chicken pox, and why does she need the sick note, and details about her work history. And other than that, you can just ask about like how can you help her. So basically,
Yeah.
you are not going to give her the sick note. You have to counsel her in this station. And you have to give an alternative method, which I would be listening to you, that what kind of alternative you will be giving instead of fit note.
Yeah.
So 8-minute timers, anyone can put in this.
Yes, I can do that.
Begin. Enter the room.
Yes, you can start.
Hello.
Hello.
My name is Dr. Imran. I'm one of the doctors working in this GP surgery. Can you please confirm your name?
Well, yes, doctor. My name is Anna Smith. I am 35 years old.
And what can I call you for the purpose of
And
consultation? And nice to meet you.
yes, doctor. Thank you, doctor. I'm here for my son. He is not feeling well, and I really need a sick note for that.
All right, I am here to help you out. And you just mentioned about your son. Can you just confirm the name and age for me, please?
Oh, well, yes, doctor. His name is John Smith and he is 80 years old.
Okay, and you mentioned he's not feeling well. Can you tell me more about what do you mean by that?
So, doctor, he was having these rashes on his body, and then I took him to the doctor, the GP, and the GP told me that he's having some chicken pox.
Okay, and when did this happen?
It happened like a week ago.
Okay, and how is he doing now? Any
Well,
fever?
he's having a bit of fever and also itching on his body.
Okay, I see. And does he has any rash now?
No, doctor.
Okay, and he's eating and feeding well?
Well, yes, he is eating and like feeding well. He is taking the meals.
All right. And how about you? How are you feeling? Do you have any rash?
Oh, no, doctor. I don't have any rash. I checked myself.
Okay, I see. And who else is at home other than your child?
Well, I have a daughter as well.
How old is she?
She is 10.
Okay, she's fine if she's any rash or any fevers.
No, doctor. She doesn't have any kind of fever or rash.
Okay, I see. And you just mentioned that you need sick note. Can I ask why do you want that sick note?
Oh, well, yes, doctor. I need a fit note because I am the only carer. I am a single parent. I don't have a husband. So I need to take care of my child. He's all alone, and for that I want a fit note so that I can take care of him and I can take some leave from work.
I see, I see. And what do you do for your work?
Well, I work as an assistant in the production company.
Okay, and when you go to work, who look after your child?
So he goes to school, but obviously he cannot go to school with this rash because the rash is subsiding, but there are still spots, and the GP told me that maybe the child has to stay at home for 2 weeks.
All right, I see, I see. And do you have any family members around near you, or do you have any friends?
No, doctor, I really don't have them.
Okay, I see. And I mean, can you tell me a little bit more about your job? I mean, have you ever tried to talk to your boss about this problem?
Well, one of the parent, they had the same issue. Their child had some other illness, so they tried taking some off, but they were just given an off of 2 days. I've already taken an off for 4 days, doctor, but still, they are calling me for work, and I have to go from tomorrow, and I really need
That
this fit.
being mother is very hard. And how are you coping? You mentioned that you are the only caregiver for your child and you got two kids at home. How is everything? How are you coping with this?
Well, doctor, it's really very tough. I have to look after the house and the kids and the study as well. So it's really very difficult. I'm struggling a lot, and I need some compensation, because if I keep on taking the offs, they are not going to give me my pay, and also maybe I would lose my job, which I don't want.
I see. Yeah, you're really worried. Do you have any child? Are you on any child benefits for your kids?
No, doctor.
Okay, all right. So, Mrs. Anna, as you told me that your child has chickenpox last week and he's getting better now, but it is really hard for you to look after them as you're working, and it is very hard for you to get the off from your work, right? And
Yes,
you're
doctor.
looking for load. But unfortunately, I'm really sorry, and unable to give you the fit note.
Why, doctor? Why can't you give me a fit note? I really told you a genuine reason.
Yeah, do you know exactly why we give and who we give the fit note?
Maybe you can give them to the carers as well.
Okay, I see. Let me explain it to you. The fit note or sick note is just for the persons who is sick or who is looking for the fit note. Okay. So as you mentioned that your child is sick, and so we can't issue a fit note to the carriers who is looking after them.
Okay, all right.
But there are many things that we can discuss that how
Even
we can go ahead.
talk to your sister, maybe he can give me a sick note or a fit note, maybe something like this.
As I mentioned, we just give to the persons who is sick. So unfortunately, I'm really sorry that I'm unable to help you with that.
2 minutes remaining.
Yeah, but as
Okay.
you mentioned that you are really struggling, I will definitely advise you that you should go and talk to your job manager again. Might be he will be able to understand and he can give you off.
So you are telling me, doctor, you cannot do anything for me. Is that right?
Unfortunately, there are few obligations being a doctor, and one of them is that we cannot issue a sick note to the persons who is looking
Okay.
after.
Doctor,
Yeah,
what
we
if
can
you write
only.
description that I also have some symptoms of chickenpox? Would then I be getting a sick note?
I see you are really worried and for your job and for your kids, but I asked you about the symptom and you mentioned that you're fine, you don't have any rashes, so and your child is also getting better now. So unfortunately, I can't provide anything for you, but as I mentioned that you can talk to your manager, might be he can help you out. And other thing that I can advise you is that maybe you can talk to the Citizen Advice Bureau also. They can also help you with that, for the compensation if you want.
Okay, can they really support, like in my child,
Yeah,
really
they can
support?
help. Yeah, they can help you financially also, and they can also advise you how you can, manage this thing. Like they can offer you to like discuss you the different options. Like if you want to switch the job, might be you can consider that also.
Okay, all right. But doctor, I
Anything.
what would I cannot do something immediately, and you are saying you cannot give me the fit note.
Yeah,
I'm
I
really worried.
also, if you have any family or friends nearby, you can ask for their help. Like if you have any family members, they can look after your child. And
Move
if
on to
still
the
you
next
are
station.
really struggling, we can offer you the nursing home care.
Okay, thank you so.
Thank you very much, but I want Ramesh, I think Ramesh has a lot of things holding on his fingers, so he want, I know. But before that, if I start, you have knowledge, but few things Ramesh will tell, which I can read from her face, that she want to speak on. So, because she would speak, and after that, I will talk about the consultation is good. I notice a slight red flag in your consultation that Ramesh might tell you about that, but
Yeah.
consultation is good. That red flag is empathy, was bit more empathy was needed there. So the only thing which I've noticed.
I
apart
try to
from-
be very, very much empathetic. I'm not that much, you know.
Yeah.
With Dr. Ramesh, I was so much empathetic.
You tried well, but again, bit of more help.
I pretend to be empathetic, you know.
You're pretending, but again, let's listen from Ramesh. The consultation is good,
Yeah,
but how we can improve more about empathy?
I
will
know,
talk
I
about
know.
it. Let's listen to the Ramesh first. Overall consultation good. That is a passing consultation, depending on the examiner
Yeah,
as well. But here, let's what Ramesh says. Let's listen
Yeah.
from Ramesh. Okay, Ramesh, yes.
Okay, so basically the overall consultation, it was good. You were addressing my concerns as well, but I would like to add a few things in the concerns part. Other than that, I would like to mention like your history taking, that data gathering, that was good. That was okay. You took all the history. You talked about me. You talked about my son. You asked about symptoms. Maybe you can add flu and cough as well in that for any respiratory symptoms. Other than that, the history part was fine. Moving on towards the like management part, also empathy was missing. Like when I came and I told you that my son has chicken pox, so maybe I need, as a parent, I need some reassurance from your side. Oh, that's really sad, how you coping with this? I see that being a mother and seeing your child in this situation would be a bit tough for you. How you coping with all this? So she would
Yeah.
start telling you how she is coping, and whatever she's going through, so she'll tell you about that. Other than that, in the management part, so basically you are not allowed to change the notes, you are not allowed to give any fit notes, but I would like to mention you that you have to tell this to the patient, that this is against your medical ethics. They the examiner here wants to listen to this, that you know about the good medical practice, you know about the GMC guidelines, and you know about the medical ethics of a like doctor who is working in the UK. So you have to act like that, but I cannot change the information. As you told me, you don't have any symptoms, so it is impossible for me to change the information. It's against my medical ethics. Other than that, also I cannot add further information into your notes, because I'm obligated by GMC that I cannot add any kind of false information. I could lose my license if I do that. So these are the things which you can talk about. And when I mentioned my senior, so you have to say that yes, you can talk to my senior. I can call my senior and maybe he can talk to you, but my senior can't do anything, because we all are binding under the same rules and regulations of the GMC. I'm really sorry. I wish I could do something for you, but at the moment I cannot do anything for you. What like solution you can offer? You talked about Citizen Advisory Bureau. That was good. Other than that, you can give a carer note, as far as I read the scenario. So you can tell about the carer note that you are the only carer who is looking after the patient, and if they can give you 2 or 3 more days off. In meanwhile, in those days, maybe you can arrange some support for your child. You can arrange some like some family member, or maybe you can get help from Citizen Advisory Bureau or social services in those days. So yes, you can go with this.
Thanks. Yeah.
Thank you very
Otherwise,
much.
yes.
You've written something, Ella.
No, after Ramesh, some notes.
Yes, Ramesh,
Done.
could you? Done, she's done. Yes, Alana, your turn.
Yes, maybe too serious, but
Straightforward. I've written the
straightforward,
word,
yes.
I've written the word straightforward. I've seen a lot of patients. So when I see patient, so you have to do sugar coating. And the last thing would be, and I would say I'm afraid. Ask question, like I'll talk about it. Let's finish Allah first, then I'll tell you how to do it.
No, you're right. That like it like your everyday's job to you were like a bit tired. Yes, so it's your job just to talk, not individual approach, maybe like this.
Okay, so I will talk about that anyway. It's nothing much to be done, just a bit of change is needed.
Yeah.
I'll talk about that. You'll understand when I would say. Because we are not focusing on 6, 7, because 6, 7 is depending on that. We are focusing on why these type of emotional scenarios, tough scenarios, we have to everybody say the same information. How we deliver it, that does matter. So Alina, what would you say if you have to do anything? And we have Kazmi as well. Kazmi will also talk about a few things. If Kazmi, so he will might be able to explain a bit more about that. Kazmi, Alina, if
Hello,
you
hi,
think,
hi.
yeah, yes, Alina, if,
Sorry, there,
let's Kazmi, you do
there
first,
was,
okay?
yeah, yeah, there was a lot of interruption and I could not follow the whole consultation, unfortunately. Um, it was from my side. So I think he knows the scenario and he was asking right questions. But I think, as Ella said, I think, a body language, the way you talk, and it is very important in exam, that, IPS. So that is something needs to be improved. Um, Apart from when you said I can't give note, and then she said why, and then you said, do you know where which patients or people we give the sick note. So I think that if that part should be first, then so talk about that I cannot give. So you are trying to get the idea, the knowledge of the patient, isn't it? So maybe the patient has some information or somebody given information that GP can help. Yeah. So that should be first, like, and then when you know that what is the knowledge of the patient, why she's actually here, what is her belief, and so then you say, yeah, so you explain that these, the sick note is actually for this, and as here you are not sick yourself. So unfortunately, this is something I would not be helpful. I'm afraid to say. So a very nice way, when you say no, even no, it should be in a nice way that the other person do not feel bad. So that is actually they're trying to see in these type of scenarios. So rest after that, I could not follow what happened. Sorry.
So, Dr. Kazmi, can you put some light on like when to give a like fit note, and if a person is there who wants a fit note and who is perfectly fine and wants a fit note for their child, so what would be your suggestion that you guys do in like the NHS? So you can
I
tell.
don't know in a primary GP setting. I haven't worked yet, but in whoever comes to the hospital, even we when we get sick, for 7 days we don't need to get any sick note from GP. After 7 days, when more than 7 days, then we call the GP and ask for a sick note. Yeah. So and the GP should know that why you are sick and what happened. So it should not be like I am sick, give me a sick note. So during that 7 days I should call my GP to inform that this is the issue, and if you're not getting better after 7 days, then you ask GP that due to my this issue I'm still feeling this, and I my work is. So they just give you because they know history, you already told them. So that how it works. um,
But what
I
about
don't
if
know
they
if
or their like kid or someone else at home? They are not sick
I'm not
themselves.
sure. I'm not sure
Yeah,
because it should be gone to the where they're working. The policy of that company where they are working. There should be some by GP. I don't think so can recommend such thing. I don't know. I'm not sure about that. But
Okay,
it
thank
should
you.
be the a policy of that organization they are working with.
Okay,
okay,
thank
that's
you.
fine. In this particular scenario, they will put a sick note in your exam, and she would be very demanding, and she will try the best to get the sick note. And she would say, I'm single, I'm this, I'm this, I'm this. She would be starting maybe angry at you, crying and saying like, doctor, you're not helping. So the point which I try to understand. So just break it down, this approach, Imran. Basically, you know everything. Yeah. But the thing is the delivery method, the way how you say that is little bit of change. If you do that, you can score very good in that. So let's start. Let's break it down. So she is coming for a child. I understand your mother. The first thing was acknowledgement. Yeah. I should be helping you. You're not saying help is sick note. Should be helping you. You need to use the word should be helping you. I'll try my best to help you where I could. Okay. Ask, divide your presenting complaint in two parts. Child, mother. Take the symptoms of child, eating well, drinking well, anyone else. and pregnant women or something like that. Second thing, mother itself has symptom now or in the childhood. Two, 3 questions. And she would give you her concern in the start. Can you give me sick note, please? You did ask about the chicken pox symptoms in mother. You did ask about reassurance was not there. You didn't tell her that you should be helping her. In what ways? That's a different point. Okay.
Okay. Yeah.
So you should be telling her that you will try your best to help her, should be helping her in some way. Okay. Then you did ask about the questions about the child and mother. Then we moved slightly bit in the consultation. So you could have ask about a little bit history about the situation at home. Social history was important. Who take care of the child? Any relatives, friends around the child? Okay, you mentioned that you're a single mother. How you coping? Okay, this must be hard. What happened when someone gets sick? Where did you get help? Okay, this is the first time you're seeking help. Did you did you inform your job that your child is sick? What they said to you? Did you inform your job? And how many days you already took off from the job? The social issue is here. When talk about the social issue, you need to talk, have you spoken to, had a chat with your manager? What type of job it is? More question. Oh, I see. I must not blame you then. You definitely do need someone to care your child. It's a hard situation for you. And you don't have any. It's a tough situation at you, and you mentioned you're a single mother and the child care is compromised here. You are on the patient side now. You're trying to be on her side and she'll think he will give me sick note, but you will drag that thing. You are on the side of the patient. Okay. Oh, I see. So let's think about that. I should be asking a few more questions. Ask question, job. Have you tried speaking to your manager? This should be in the data gathering.
Yeah.
And do you know about this? Do you know about this? Do you know about annual leave? How many annual leave left? Have you got annual leaves? Are you entitled to have annual leaves? Okay. Usually what happens was your company policy for giving. Now, coming to the point, Lita, then you don't say, unfortunately, I can't give you. Lita, I understand you as a single mother, it's very difficult for you. And you love your child. And the child care is our priority as well. And you've done the right thing coming over here. Okay. Speaking to us. Definitely, I should be telling you what are the different ways where you might get. Okay. So let's talk. You did mention you haven't spoken to anyone. So you said you don't have friends and family. So anyway, nobody can come for care. So let's come into the second thing. First, talk about all those things. Now, is that possible you speak to your manager and talk about that they could give you some annual leave? No, doctor, I don't want annual leave. Okay, don't want annual leave. Do they have any child care leave? No, doctor, I don't know. I don't know. Have you checked with them? Okay, no problem. So what should we do? You talk them any annual leave or anything. Okay. Then next part. Do you know about that they do give a child care leave as well? But then she said that, why don't you write it? You said that I just asked you, never confront patient. That I just asked you, you denied any symptom. You don't need to say that. I understand you want to take care of your child. And that's why you want asking me to change something. But you know that if I write something which is not right, do you think, is it fair or just a truth or lie, isn't it? First say that. And I'm afraid as a doctor, I'm not supposed to write something which is not right. Yeah. Which will put me, don't say that I'll lose my GMC or something. Say that, but say that we have something the good medical practice tell us about, to be honest. Talk about the good medical practice handbook, if you've seen, is honest. They always expect us to be honest. But we are here to support you. I know you are thinking all that sport and health. That's the thing you need to mention. I need to be honest. Anyway, so don't say that I will lose. Don't say that unfortunately I will. Don't say this till end.
Yeah.
Still giving options. Still giving option. Doctor, why can't you give that? Again, Lita, I just want to tell you, if I write something which is not right, do you think should I do that? It is not right. And our good medical practice handbook, doc, you should be honest. But I want to help you. I can tell you different options. One option is that you speak to your manager, number one, the job thing, what you say. Second option, third option, that there is a carer note. I will speak to my seniors if there is any carer note or anything that which we could give, and you speak to that. If you feel sick in future, if you feel sick because you have a child who got chicken pox, if you feel sick in the future, you know that you can self-certify sick. Not now. Don't tell them to do something wrong because she's not sick. But in future, if you have any symptom, you can self-certify and you can come again. But now I can offer sick note for the child, not for you. Child may be 3 months old.
Yeah.
And the carer note, I'll speak to my senior. Do you understand the way of delivery
Yeah.
and drag till end? Do you understand? Drag till end and sportive, happy. She should feel like that you will give sick note, but at the end, I'm afraid, I'm sorry.
Yeah.
Okay, you're getting my point. So that should be on the last 1 minute. When you say I'm afraid, I'm sorry. First 7 minutes, oh, I'm sorry, you're going through that. You have to do that.
Right.
You got my point, what I'm trying to say. So this is the way you deal with that. But anyway, you've done well, you know everything. The only thing is that how to drag it till end and how to say no. So negotiation skills. Here you need to know the negotiation skills. Everybody should know the negotiation skills anyway, but that is negotiation. You have to negotiate. So I believe doctors online have enjoyed it. Vaccination history is important for them, and that was a good session. We don't able to do one more scenario. Anyway, we'll do next time. And again, Allah, you done well. Imran, you done well. And Justin, you done well. Ramesh and Kazmi, thank you very much. And again, Dr. Insha, you done well. So tomorrow's thing is that I just want to tell you the academic calendar if you are coming over. So we are running face-to-face simulation the same way in the round table form, where you can participate for 1 day for free if you want to do. And you can come over. That is the topic wise you need to know. If you're living around in Manchester, you can come over. So 5 to 7 doctors, and they're doing recalls, they're doing the topic wise simulation, 11 to 2, 11 o'clock in the morning till 2. Then at 4 o'clock, 4 to 6, which is free, where you can perform as well. And we have a mock running every Wednesday. That is a full mock and clinical mock we done today, introduced clinical mock. What is clinical mock, guys? Clinical mock, all examinations, all procedures, all prescriptions will be done. But before that clinical mock, we recommend you take a circuit class. So recently, Imran have done that circuit class. Insha have done that circuit class. I would like to ask Insha. So what do you think about the circuit class? How it was in the 4th station? What do you think about the circuit class? We have 4 stations in the circuit class, 4 round tables in which you will have 4 mentors. One mentor will be teaching you prescriptions, and you will see how to use a BNF. And one mentor will be teaching SimMan, and you will perform SimMan in real time simulations. And then you will do the third round table would be about exam. So one table is prescription and procedure, and there is examinations, and you will have real patient examination as well. That circuit class. So Alina recently attended that circuit class. Honest opinion about the circuit class. What was your experience?
It was very good, actually. The circuit class was very nice and everything was explained so well. All the tutors are very nice. And it helped so much in doing the mocks today. It was very, very good.
Yeah, so the clinical mock and circuit class will be connected. That means if you take a circuit class that would have 4 tables, then clinical mock will include everything: prescription, examination, procedures, and everything. That is only 8 station mock. And if you want to book that,
Yes, Dr.
you
Zishan, I will also endorse. It was very, very, very much useful for us.
well, thank you very much. Thank you very much. And brilliant. So I know the thing is that what we are trying to do, we're trying to help you guys. And Javedia, thank you very much. And if anyone need any of the things, do let us know. I know I started in January, but the doctors which I got, especially Allah, especially they put trust on us, and they are very good. And the doctors are passing 13, 14, 15 stations. And this is the word of mouth. And this is the thing
Yeah, yeah.
which we are doing, appreciating tutors. Lot of people appreciate Ramesh, Mai, and all of us. It's like a very friendly environment. This is what we need to create. This is what we need to perform, more personalized thing. So we have more than 6 to 7 mentors which are available for you guys. And next course is on 12th of August. So if you want to enroll, few discounts are there. You can chase us. You can speak to any of the old students who are already here. And definitely, we are trying every day to improve. And definitely, we will be improving more. And but what we are providing is totally based on according to the MLA pattern. I've been a tutor, teacher, simulation-based teacher, 4th year medical students in the Salford Hospital here. So sometimes people say, do ask about qualification, what you'd have done. I don't like to tell that, but I have 4 degrees of 1 degree apart from medicine. I've done master's public health, master's political sciences. I've psychology, sociology degree as well. I've been teaching from 2013. I've taught in different industries. I taught medical student, and I'm working as a A&E doctor from a few years. And I've worked more than 5 hospitals. I never teach, but sometimes I never tell people, but sometimes people do ask, what is your qualification? Since I passed my Plab 2, even from Plab 1, I never stopped teaching. I'm teaching since then. Myself passed 15 station, and I love my student passing all stations at 15. So I love teaching, and I love all you to pass as soon as possible to unlock your dream. And hope you all well. Good luck, and we'll keep doing this free session as well every day. And good luck, guys. If you need any help, any of the resource, do let me know. Paid, unpaid, we are more than happy to help. Okay, guys, take care.
Thank you.
Thank you.
Thank you. Thank you very much.
That's good.